Well, for more, we are reaching out right now to Dr. Aqsa Shaikh in New Delhi. Dr. Shaikh is the head of the COVID-19 Vaccination Center at the Hamdard Institute of Medical Sciences and Research. Dr. Shaikh, thank you for joining us today.
Thanks, Michael. My pleasure.
Now, of course, we've heard the devastating numbers out of India, but as someone who is on the front lines, how has that translated into what you're seeing in your hospital?
The tragedy, if I may say so, is literally unprecedented. We have never seen such a big devastation happening with reference to COVID. We had seen COVID in the last year also, but the figures right now are at least 3 to 4 times higher. And the number of deaths are just, the deaths number, they don't just stop happening. So in Delhi, for example, we are getting 25,000 new cases every day and almost 300 to 400 deaths happening every day. There are no beds left now. There are no even spaces in the crematorium or in the graveyards. So the streets are now overflowing with people, wanting to get admissions into the hospitals, but there are no beds. And most importantly, Delhi right now is gasping for oxygen. We do not have enough oxygen equipments. We do not have enough oxygen supplies. So the situation even in our hospital right now is that we, every 12 hours, we are simply praying that we get the next supply of oxygen so that our patients do not suffocate to their death.
So a horrible situation for patients needing help right now, but I'm also wondering about your staff and how they're doing in this moment, this huge surge of patients, this lack of supply to help them in a horrible moment. How is your staff doing right now?
Fortunately, since this is our second year with COVID and our staff was mostly vaccinated, so a lot of them are now having some form of immunity or protection. Even if they are getting infection, the infections are mild. So like last year, we had lost a lot of doctors and nurses in India to COVID. Fortunately, this time, though the doctors are getting infected, we are not at least losing them. But yes, it's a very difficult and heart-wrenching situation when, even though we may have doctors available, we do not have enough oxygen to supply to our patients. And then to see our patients, literally suffocating to their death in front of our eyes, it's really very heart-wrenching.
And what are they saying to you? What are you hearing from your patients as they undergo this horrific challenge and at times losing this challenge?
Well, when it comes to the patients, I mean, you just open your WhatsApp or you open any of the social media and there are desperate calls and SOSs all the time, for oxygen cylinders, for beds, for ventilators, for ICU beds. And unfortunately, we are not able to help them. The situation right now is unmanageable. We are simply living a disaster. And there's nothing much, that we can do other than watching these people die. And these patients, they are the ones who have money with them. But unfortunately, there are no beds or there are no medicines or oxygen available.
Now, of course, the sadness of this is that India has really already helped the world by producing millions and millions of vaccines that are being put into arms, as I say, around the globe right now. And now India is asking for international help. How do you think countries like Canada might help and alleviate the suffering that's happening in your country?
It's really, the failure of our system and our governments that we didn't prepare enough for the oxygen infrastructure in the last 1 year of opportunity that we had. As a result, now we have to literally, ask other countries to help us out with oxygen equipments, oxygen transport equipments, and storage equipments. And fortunately, we have been getting some aid, but then I'm afraid it's going to be too late, before it reaches the patients. When it comes to Canada, again, we really need help in terms of oxygen transport and storage equipments, even oxygen concentrators, because that can act, as an ad hoc mechanism of providing oxygen to patients. Also, in the medium term, the economy is going to suffer a lot because almost half of the India is now under lockdown, and this is going to be, make a lot of people slip into the poverty line. So we really also need a lot of economic impetus there.
Dr. Aqsa Shaikh, thank you for this. We appreciate the time, and of course, we wish you well.
Thank you, Mike.
And Dr. Shaikh is the head of the COVID-19 Vaccination Center at the Hamdard Institute of Medical Sciences and Research in New Delhi.